Yeah. So we'll have the next speaker, Dr. R.S. Chauhan sir, and he'll be talking on rare and interesting cases in ophthalmology.
Respected teachers on the dais and dear colleagues of the dais, I am talking about some interesting and rare cases in ophthalmology. This is the first case. It was in 2005 in Oman. The patient had history of injury with wooden stick, but when careful examination was done and X-ray was taken, then it was a metallic phone body, and further counseling revealed that it is a gunshot injury. And this was the gunshot injury which was seen on the X-ray examination, and finally that had to be taken out. So sometimes the patient gives wrong history, and if you do not do proper examination, you probably can leave it. So it is better to always counsel, and in any orbital trauma, X-ray is a must, because that is non-invasive, and sometimes if there is metallic phone body, then it can be pointed out. This is another case in 2006. This was a 25 years old kabaddi player. So there was history of injury with the knee while playing, and history of LASIK surgery. In 2006, it was like in Gulf country, because they used to go abroad and get surgery done and come back. And on examination, it was avulsion of LASIK flap. So sometimes you see the problem is that in Gulf country, you cannot touch the eye, and if something happens, they will put you behind the jail. So that is why nobody was touching it. So that flap appeared to be clean, but when I washed it and with the gentamicin, it became little opaque. So I was worried what happened. But final cleaning with the normal saline, and it was deposited back, and after 1 week there was interface debris, which was called sand of Sahara. This was one of the interesting cases at that time. So these are the other photograph of that case, because that had to be kept on watch, because there was no cornea specialist at that time in that particular area. So patient refused to go anywhere else. This is another patient. This was a young girl, 18-year-old, and she had injury with the lead pencil. This in the childhood, and this was lying there for the last 12 years. The vision was maintained around 6/9. This phone body was removed, and there was no inflammation. But the problem was, because after the removal of the phone body, that healing was delayed, because that lead particles were not removed from that area, and it had to be sutured again. Now this case was also published later on, and what happened? This is another very interesting case. This patient, he was a 12-year-old boy who was swimming in the sea, and when he came out next day morning, he started having orbital cellulitis. He was treated with IV antibiotics and anti-inflammatory, but he was not cured at the peripheral health center for around 10 days. The patient was referred to us. When the X-ray was done and the CT scan was also done to find out what is there inside, to the utter surprise of the radiologist, he called me actually. He told me that Dr. Singh, listen, there is some phone body, the value of that Hossenfield value of that is more than the bone, but less than the metal. So neither it is metal nor bone. Then what is this? So this was, the globe was intact at least, and this orbital phone body whose Hossenfield unit value was more than that of bone, that was 700, and less than the metal. Usually metal is 3000. So this careful history was taken, and the father of that boy told that there is a fish which is called flying fish. It jumps with a speed of 120 miles per hour, and sometime this fish will strike the face, and this beak will enter into the orbit, and it must have entered into the orbit, and probably that is the phone body. and he actually brought that fish, and that fish was shown to me, and then this phone body was removed, and this was another very interesting case. This is another interesting case. This was an IPS officer admitted in Ward 11 in PGI Rohtak. Dr. Nagpal was treating that patient, but that patient was not allowing to touch the eye. He was having non-healing corneal ulcer. So he asked me to examine properly and find what is the problem. But he didn't allow me to touch the eye, so I told him, listen, I cannot do anything without touching the eye. Put the paracan, took him to the minority, everted the upper eyelid, and to my utter surprise, there was behind the upper eyelid there was a ring of the eye drop. Can you see that? This is the ring that between the cap and the bottle. That ring was underneath the upper eyelid, and that was causing irritation to the cornea, and that is why it was not healing. So that was taken out, and after that that patient healed. So these are some of the interesting cases I encountered.
Thank you so much, sir. Very interesting cases, and I wonder what happened to the child with the pellet, because here we are obligated to inform the police. There, what was the, there they would have, killed the person who. So was it informed there? Is it mandatory to inform the police?
There is different department. Medical legal department is different. Everybody is different there. So our job is to do our job. So their job is their job. So but they will take care of it. If you find a pellet,
do you have to inform the?
No, that everything has to be informed, because the radiologist will inform that there is a pellet.
Thank you, sir. Thank you so much. And
sir, one comment I would like to make. Thank you for the. It brings a memory that what can happen in Rohtak doesn't happen in any other part of the world, and practically anything can happen in Rohtak. I've had the chance of having all types of injuries: tractor, combustion chamber injuries, blouse hook injuries. The tire blast injuries. So Rohtak has its own charm.
See, actually, what happens? It is not the Rohtak, because nobody tries to touch those patients. They will refer the patient to
Actually,
RIO.
Sir, Rohtak patients do not allow anyone to touch them except Rohtak doctors.
See, that patient was police personnel, IPS officer. So nobody was even. So I was wondering how that ring went inside the eye, inside the upper lid. Yes.
So maybe he thought it was a golden ring and he was trying to smuggle through the customs.